Hi everyone, I'm Lisa Gillespie, craniosacral therapist and restorative exercise specialist. Today I want to talk to you about 4 things that you can do to help yourself have better alignment and decrease pregnancy aches and pains. We're going to first look at sitting habits. So there are 2 tendencies that we have when we're pregnant especially, although not always. This can kind of bleed into from habits that we had prior to pregnancy that are then exacerbated once we become pregnant and have greater mass out in front of us. So 2 habits that we tend to have when we are sitting are that we tend to tuck the pelvis under and sit back. So I'll show you here from the side. If you look at this part of my back here, this would be my sacrum. And then above my sacrum is my lumbar vertebrae, which should have a little bit of a curve in it. When we are tired and fatigued, we tend to collapse under and tuck the pelvis under and sit back so that we are a little bit more slouched. And you can see here on the skeleton, so this would be the back side of the skeleton and the front, the rib cage. So you're looking at it from the side. We have a tendency to, when we sit, to what we call tuck under, so that you are asking. If we look at the back of the pelvis, I can show you here, we've got the left and right sides of the pelvis, the ilia, and then in between the ilia is the triangular shaped bone called the sacrum, and then at the bottom of the sacrum is the tailbone called the coccyx. And during pregnancy, there's a lot of ligaments that weave between each other to support the sacrum and stabilize the sacrum within the ilia. The sacroiliac joints are here on either side. During pregnancy, those ligaments, due to the hormone relaxin, tend to get a little more slack. And if we haven't been, prior to that point, if we haven't been stabilizing our pelvis with our musculature, but rather have been relying on our ligaments to provide stability, then when we're pregnant and we have increased levels of relaxin, the stability that we were relying on the ligaments to provide gets a little bit more lax, and the fact that we haven't been using our muscles to stabilize the area becomes all the more glaringly apparent. So let's start using our muscles and our bones the way they were designed so that we can help make up for the ligament laxity in this area. So when you are sitting, you want to be sitting on, here's the underside of the pelvis. You want to have your weight supported on the sit bones. There. What tends to happen when we roll back, when we tuck under and we slouch, we're asking the coccyx and the sacrum to support our weight. And the problem with that, or the challenge with that, is that because this area is not as stable and is a little bit more mobile during pregnancy, when we sit back or tuck our pelvis under and ask the sacrum and coccyx to support our weight, we are further exacerbating the instability that's present here, especially at the sacroiliac joint. And we are, by virtue of putting pressure on this bone, because the sacroiliac joints aren't fused joints, there is mobility there. When we put pressure on the sacrum, we are gently or slowly, in minute increments, moving the back part of the pelvis, the sacrum and the coccyx, closer to the front of the pelvis, or the pubic bone here. So we're decreasing the space of the obstetrical conjugate, or the area where you want to have the most space to allow for the baby's head to pass out. What also happens when we have this area decreasing space due to pressure or other postural habits, there are all of the muscles of the pelvic floor that attach here. So they run from the back of the pelvis to the front of the pelvis, and they also run from side to side. When those muscles are put in a shortened position, which is what happens when we decrease the space between the back of the pelvis and the front of the pelvis, When those muscles are in a shortened position most of the time, or the majority of the time, they adapt to being in a short position. And that means you have the muscles of the pelvic floor being in a short, tight position, which then when it comes time for you to give birth, you want those muscles to be able to lengthen and relax and yield to allow for the passage of the baby out of this area. That is going to be a little more challenging because you have developed habits that have increased the tension in this area. So let's work to change those habits so that we can decrease the amount of tension that is present in the pelvic floor. We don't want excessive tension there. We want just the right amount of tension to support the organs and to support the uterus, and then to be able to relax and yield so that the baby's head can pass out when the time is right. So that is one reason why we want to be really sure that we're sitting right up on the sit bones and not defaulting into the tucked pelvis. You can feel this in your own body. You can play with this by just noticing what's it feel like to sit so that you can feel the bones on the underside of your pelvis, and then what's it feel like when you roll back. It's kind of like a rocking chair. So if you roll the rocking chair back, you can feel how your weight is more on the back of your pelvis, and then you can roll the rocking chair forward so that you're sitting up on those bones of the pelvis. Now, the other thing to be mindful of when you're sitting, especially when you are sitting on your sit bones, you may notice a tendency to kind of stick the chest out, or especially stick the ribs out. And that's something that you want to be really mindful of anytime, and especially during pregnancy. There is a condition called diastasis recti, where the rectus abdominal muscle, that your six-pack muscle, if you've ever had a six-pack, I've never had a six-pack, but in your fantasy world, if you ever had a six-pack, diastasis recti occurs when the two halves of the rectus abdominis separate, and it can be a temporary separation, or some women notice that they continue to have space between those two muscles long after their pregnancy has ended. It's also a condition that can be present with men, so it is not a result of pregnancy per se, but it is a result of habits that tend to become exacerbated when we are pregnant or when we have a lot of mass in the abdomen. One of the ways to decrease the risk of that is to allow the rib cage to drop down so that it's kind of melted down into the abdomen. So if you were to feel the front of your rib cage, you would not be able to get your fingertips up and under the ribs, whereas if you're sticking the rib cage out, you can get those fingers under the ribs, and they're really protruding quite a bit. So we want, as much as possible, to relax the rib cage down. It would be really, really common for you to feel like when you do that you're slumping and that you have horrible posture, because culturally, we think of good posture as having the chest up and the shoulders back and your back straight. And while all of those topics are great questions or great things to address, I'm going to narrow the scope of this video and skip addressing them, but just let you know that when we have the ribs dropped down, so that if I were to draw a line from the front of my rib cage to the front of my pelvis, those 2 points would be stacked right over each other. What happens when I stick my ribs out is my rib cage is in front of the front of my pelvis, and then the muscles that attach between those 2 points creates a different tension pattern, and it actually weakens the muscles, specifically the rectus abdominis and some other abdominal muscles as well. It decreases the amount of force that they are able to generate. We don't want too much, but we don't want too little. When we are able to drop the rib cage down and stack it over the front of the rib cage, over the front of the pelvis, then we create the optimal amount of tension in the abdominal muscles so that they are able to support us and minimize the risk of diastasis recti. Those are two things to pay attention to when you're sitting. Now, let's look at two things you can pay attention to when you are standing. So when we're standing, and especially when we have greater mass out in front of us with a growing abdomen, there's the tendency to shift the weight forward. So if you look at some of your pregnant mama friends, you may notice this is a really common pregnancy posture for the hips to be way out over the front of the feet. And what that does is, again, it changes the relationship between the front of the pelvis and the front of the rib cage so that we're distorting those two attachment points for the abdominal muscles here at the front of the ribs and the front of the pelvis. We're changing the amount of load that's placed on them. So we have a growing baby, which creates a growing uterus, and we've got this natural amount of stretch that is happening in the tissues in the front of the body. When we also shift the pelvis forward, which causes us to shift the shoulders back, we're changing this area here. We're creating a little more stretch and tension through this area, which is already under tension. And again, this is something that makes us more prone to separation of the rectus abdominis and makes us more prone to the diastasis recti. So, two things to watch when you're standing are, number one, can you back your hips up so that you have a straight line between the outside edge of your ankle and your knee and the center of your hip. So those 3 points should be stacked over each other. The outside edge of your ankle, and you may notice you've got a little bump on the outside of your ankle called your lateral malleolus. That point should be stacked over the center of your knee, should be stacked over the center of your heel, ideally. If you've been doing this for most of your life, pregnant or not pregnant, this can feel really strange and weird, and it may feel like you're going to fall backwards because your backside muscles, you haven't used them to support you in standing for quite a while, if ever, and they've kind of gone on vacation and forgotten how to work and forgotten what they're supposed to do. So that abrupt transition to being completely stacked vertically may be a little too much, may feel not stable for you. So what you can do is just play with backing it up incrementally. So take baby steps to work your way back. As you do, you'll start to wake these muscles up, the glutes and the hamstrings and the lateral hip muscles, those muscles on the sides of your hips, and they'll be able to support you as you learn to stand with your weight stacked vertically, ankle, knee, over, under hip. So that's something to play with as you're standing. Also keep in mind, if you wear shoes that have any amount of heel, a positive heel, which by definition would be shoes that have your heel, that put your heel higher than the ball of your foot. That's called a positive heel. I'm not talking about wearing stilettos. I'm not talking about wearing ankle breakers. I'm just saying any shoe that raises your heel above the ball of your foot, which if you take a look at your sneakers, if you take a look at the vast majority of your shoe, unless you've been really, really diligent about finding shoes that have a completely flat sole, 99% of the shoes that are out and available for us to purchase have the heel elevated above the ball of the foot. And when we do that, that elevation naturally moves our pelvis forward. And then we have to compensate with some bending of the knees, bending of the hips, low back, that sort of thing. So I highly recommend, if you are pregnant, or especially when you are pregnant, that you avoid heels like the plague. Your body will thank you for that. The other thing to be mindful of when you are standing is that tendency to stick your rib cage out. So just like we talked about when we were sitting, we also can do that same pattern when we're standing, of getting the ribs out in front of the pelvis. So here's the front of my ribs, and here's the front of my pelvis, and you can see those 2 points aren't stacked over each other. This is also going to create more compression in my lumbar vertebrae area, my low back area, and it's often thought that this is just a natural byproduct of being pregnant, that as the belly expands, of course you're going to increase the pressure in the low back area. But what if, as the belly expanded, what if we were also developing greater muscle mass on our backside to counteract or to balance that expansion or that increased load, so that we're able to stabilize ourselves even though we've got a growing mass on the front of our body, in the best of ways. So one of the ways that you can start to develop that strength and that additional muscle mass in your back and in your glutes is by practicing standing and by allowing the rib cage to drop down, so that as much as possible you keep the front of the ribs stacked over the front of the pelvis. So we're looking to, just to summarize, to decrease the tendency to have the pelvis over the front of the feet, which will also have great benefits for your feet. Foot pain during pregnancy is fairly common, and one of the reasons why is because we're putting increased weight over the front of the foot, which isn't really designed to be our primary area of weight bearing for the foot. So getting the weight backed up so that it's really stacked over the heels is going to help counteract that or prevent that. And it's also important that we bring the rib cage down so that we can align the attachment points of our abdominal muscles and decrease the risk of diastasis recti. So when you sit, be sure you're sitting on your sit bones. When you sit, also be sure that your rib cage is stacked over the front of your pelvis. And then when you're standing, be mindful of shifting the weight of your pelvis back towards your heels. Do this incrementally if you need to. It can feel like a huge change and very strange and weird, so do it gradually. And then also the fourth thing to be mindful of is stacking the ribs over the front of the pelvis, just like you did when you're standing, or when you were sitting. If you can pay attention to those four things, 2 things when sitting and 2 things when standing, that can reap you great benefits for your body and for your pelvis as you progress through your pregnancy and as you, most importantly, or equally importantly, prepare to give birth. Enjoy.